In the time since I've publicly come out in opposition to Gundersen Health System's COVID vaccine mandate, I've had a multitude of our staff approach me with support and more behind the scenes information. I've noticed that there are patterns happening here at Gundersen that are being paralleled throughout the country. Hospitals are not being transparent with their communities about what is going on with COVID and what is going on with the vaccines. Between our hospitals, the government, and the media, there is rampant gaslighting happening. Let's get specific to La Crosse, Wisconsin. At my hospital, part of my job is to screen admissions from other facilities. In that process, we use a system called Care Everywhere to review a patient's chart. And if the patient's never been here before and we don't know their social security number, our software makes us enter something, anything. So we put in all ones. If that patient is admitted, we now have a barrier to getting their records from other places, including the state vaccine registry. So we have patients come in from the VA, patients come in from nursing homes, and they are fully vaccinated, but our systems do not talk, and we are reporting them as unvaccinated because of how fragmented our healthcare system is. So our hospital uses these inaccurate vaccination status numbers to create dramatic social media posts that completely misrepresent what is going on with COVID in this community. Another problem with how hospitalized COVID patients are counted is the failure to distinguish between being hospitalized from COVID and being hospitalized with COVID. So grandma falls, breaks her hip, gets hospitalized, swabs positive. Now she's asymptomatic, but it doesn't matter. She's now counted as a COVID patient. Hospitals are capitalizing on things like this to push vaccines on communities throughout the country. Here's a quick disclaimer. Don't interpret me pointing this out as being anti-vaccine. I encourage anyone with questions about the vaccines to talk to their doctor. But these problems are big and they are mostly problems of negligence. I'll use these numbers because they fit the narrative I'm pushing, so I won't bother to correct them. But more problematic is when barriers are intentionally put up to having accurate data. The CDC earlier this year asked that breakthrough infections not be reported because they didn't want to encourage vaccine hesitancy. OSHA instructed employers not to report vaccine injuries because they don't want to encourage vaccine hesitancy. Our healthcare system in this country is supposed to be built on evidence-based practice. Intentionally putting up barriers to collecting evidence is wildly problematic. Another barrier to having good data to work with around COVID is the conflict of interest of our pharmaceutical companies. Big Pharma always prioritizes profits over outcomes. If that sounds conspiratorial to you, I welcome you to peruse the long legal records of Johnson & Johnson or Pfizer or Purdue. The epidemic that was killing hundreds of thousands of Americans before COVID was the opioid epidemic. A recent lawsuit involving Pfizer price gouging EpiPens also involved a senator whose family made and kept millions of dollars in the scheme. Our lawmakers and policymakers take millions in campaign contributions from Big Pharma, and they invest millions in their stocks. I hope you don't need to be convinced that that's a problem. Did you know that there's also overlapping ownership between all national media companies and Big Pharma? No problem there either, right? It is for these reasons and more that the best source of COVID data comes from other countries with both universal healthcare and publicly available data. Examples being Israel, the UK, and the Scandinavian countries. So let's bring it back to La Crosse. Gundersen is validating their hardline stance on the COVID vaccine mandate by labeling unvaccinated staff as a grave danger to their coworkers, patients, and the community. That's pretty inflammatory considering that for a year and a half, they have called us heroes and told us that by using masks, goggles, and washing our hands, we aren't a risk to anyone. So what do they know that we don't know? That's more than rhetorical at this point because Gundersen hasn't been transparent about anything COVID related. We have both vaccinated and unvaccinated staff off of work with COVID in similar numbers. We've had both vaccinated and unvaccinated staff come to work with COVID. How many times has it been spread? What was the vaccination status of everyone involved? We're in the dark, but according to hospital leadership, it's such a huge problem that they suddenly need to fire their unvaccinated staff during an unprecedented staffing crisis. Let's look at data from the UK. 67 million people, it's a huge sample size, and they put out data weekly. Okay, there's a lot going on here. First thing I'll point out is that far more vaccinated people are catching COVID, but they also have a very high rate of vaccination. So that's to be expected, and it doesn't mean that vaccines don't work. So we've got ages on the far left. Let's take a look at rates on the far right. Here's my demographic. Unvaccinated people in their 40s in the UK are getting COVID much less often than their vaccinated peers. I don't know why. Maybe they didn't get vaccinated because they have natural immunity, which has been shown to be undeniably superior. Or maybe vaccinated people feel invulnerable because they are under the impression that the vaccines prevent transmission. Who knows? That's all speculation, but you can also see that on the other age groups, it can't even remotely be considered effective at preventing transmission. On the national news here, all we hear about is what a hot mess Florida is, right? A bunch of unvaccinated plague rats spreading COVID everywhere. Obviously, that UK data doesn't apply here across the pond. Here's a very recent study from the NIH. I didn't spend a ton of time vetting it, but it's a reputable journal, and the main author is from Harvard. And take a look at that title. Increases in COVID-19 are unrelated to levels of vaccination across 68 countries and almost 3,000 counties in the US. So here's just a small sampling from this very interesting article. At the country level, there appears to be no discernible relationship between percentage of population fully vaccinated and new COVID-19 cases in the last 7 days. In fact, the trend line suggests a marginally positive association such that countries with higher percentage of population fully vaccinated have higher COVID-19 cases per million people. Part of me wants to say I told you so, but this is not good. This definitely doesn't fit the narrative that we're going to vaccinate our way out of COVID, at least not with our current vaccines. And that sucks because COVID is still spreading easily and killing the vulnerable. There's so much overwhelming evidence at this point about fully vaccinated people spreading COVID that anyone who tells you otherwise, including Gundersen, is ignorant, gaslighting, in denial. For whatever reason they have to deny it, they are wrong. Well, okay, if you concede the point about transmission, there's still hospitalization, right? That's a point that my hospital uses to justify the mandate, saying, we don't want unvaccinated staff using up precious hospital resources. Here's the most recent UK data on patients requiring a hospital bed from COVID. Again, ages on the left, rates on the right. This data actually makes a good case for the vaccines protecting the elderly. How does this apply to a hospital setting? Well, here's our CEO's demographic, vaccinated, in his 60s, and here's the bulk of the people he's firing, unvaccinated in their 20s and 30s. He, fully vaccinated, is at similar or higher risk of needing a hospital bed from COVID than many of the people he's firing. And that's not even factoring in natural immunity, which the majority of them have. Again, this data is from a population of 67 million people from very recent time span with tens of thousands of Delta COVID cases. This is far more accurate data than anything Gundersen leadership is using to justify their coercive, heavy-handed, and toxic COVID vaccine mandate. If you take issue with this video or my interpretation of this data, please leave a comment. If you're a fellow healthcare worker who has experienced something similar to this, also please leave a comment. Again, if you are considering vaccination or getting a booster, by all means, talk to your doctor. That's how healthcare should work in this country. It should never be authoritarian. Stop all mandates. Honor informed consent.